Skinfold. The purpose of the skinfold is to determine the body fat levels with the measurement of the skin fold thickness. The principle behind skin folds is that the amount of subcutaneous fat is proportional to the total amount of body fat. 1/3 of fat is located subcutaneously, but the exact proportion of fat varies with sex, race, and age. Skin fold procedures. All measurements should be taken on the right side of the body. Clippers should be placed directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Maintain the pinch while reading the clipper and wait 1 to 2 seconds before reading the clipper. Take duplicate measures at each site and retest if duplicate measures are not within the 1 to 2 millimeters. Rotate through measurements sites to allow time for skin to regain normal texture and thickness. There are 7 sites for skin fold measurements. So when taking the abdominal side measurements, you'll need to pinch a vertical fold 2 centimeters to the right side of the umbilicus or belly button. Use the skinfold clipper and place them directly on the skin perpendicular to the vertical fold. Maintain the pinch for 1 to 2 seconds, then read the measurements from the clipper. When taking the right side tricep measurements, you're going to pinch a vertical fold halfway between the shoulder and the elbow. Use the skinfold clippers and remember to be perpendicular to the vertical fold. Pinch and hold 1 to 2 seconds and then record the measurements from the clipper. When taking the right side chest pectoral side measurements, for men you're going to get a diagonal pinch halfway between the armpit and the nipple. For women, you're also going to get a diagonal pinch, but 1/3 of the way between the armpit and the nipple. Use the skinfold clippers and pinch the diagonal fold, hold to 1 to 2 seconds, then record the measurements. When taking the right side mid-axillary site measurement, you're going to raise the arm of your patient above their head. You're going to pinch a vertical fold on the mid-axillary line, which runs directly from the center of the armpit just below at the level of your xiphoid process of the sternum. You're going to use the skinfold clipper. You're going to be perpendicular to the vertical fold, then pinch, and hold for 1 to 2 seconds, then record the measurement. When taking the right subscapular side measurement, you're going to pinch a diagonal fold 1 to 2 centimeters below the shoulder blade or the inferior angle of the scapula. Use the skinfold clipper and pinch the diagonal fold, hold for 1 to 2 seconds, and then record your measurements. When taking the right suprailiac side measurement, you're going to pinch a diagonal fold just above the front forward protrusion of the hip bone or iliac crescent. Use the skinfold clippers and use them directly towards the skin, but remember to be perpendicular to the diagonal fold. Maintain the pinch for 1 to 2 seconds, then record your measurements. To take the right side thigh measurements, you're going to pinch a vertical fold halfway between the knee and the top of the thigh. Use the skinfold clipper directly to the skin and pinch perpendicular to the vertical fold. Maintain the pinch for 1 to 2 seconds and then record your measurements. Skinfold equations. To get an overall number to use as your body fat percentage, you'll need to plug in all the numbers into the formula. The 7-site formula for men, you're going to add up all the 7 sites into the formula, and you're also going to get the age of your patient, plug it into the formula, to get your body density. You're going to do the exact same thing for women. The reason why men and women have different formulas is because women typically have more body fat than men. Because of this, there are different Skinfold sites for men and women, along with different equations for each gender. Once you get the body density, you're going to plug it into two equations, the Seary and the Brosick equation. These equations help find the percentage of body fat. The reason why we want to find the percentage of body fat is to find the estimate of a person's body composition.